Thank you for joining us for Medicare 101 with Benefits in Action. Kate Kurash, Medicare counselor at Benefits in Action. My name is Christy Moran. My pronouns are she and Aya, and I am the Adult Library Services Senior Consultant at the Colorado State Library. Or as I like to say, a librarian for librarians and library staff throughout our state. Today's event is being recorded, and all registrants, regardless of whether or not you attended live, will receive an email with a link to the recording and any resources shared. At the end of this session and in the follow-up email, besides that, I will also be sharing a link to a survey. Particularly now, it's really important that the state library gathers your feedback because we use a survey to inform our work, but also to report on the value of the programming of the state library. As a special side note, today's event, though scheduled until noon, will end no later than 11:50 a.m. Apologies for that inconvenience. I'm on the road, so I'm working with schedules outside of my control. Throughout, there will be an opportunity to put in the chat your questions. And at the end and toward the end, Kate will answer your questions. So there'll be some time for that at the end. I will continue to let people in. I am going to turn off my camera. If you have any technical questions, I will also be able to answer those. So now to our presenter, Karen, go on.
Hello.
I think I wrote Kate too. Oh my God, Karen.
That's okay. Yeah, I am Karen Kurash. I am a volunteer with Benefits in Action. And hopefully you can all see my screen.
Yep.
Okay, good. Okay, just one moment. Okay, so today we're going to learn about Medicare, a very complicated topic, so we will address the basics. Okay, I'm a volunteer with Benefits in Action, and Benefits in Action is a nonprofit organization assisting adults with health insurance, including Medicaid, Medicare, and Connect for Health Colorado, and wraparound social and community benefits. We provide education, navigation, and application assistance, and we assist people across the state of Colorado. I am a SHIP certified counselor, and SHIP is the State Health Insurance Assistance Program, which provides unbiased and individualized Medicare counseling. We assist people with appeals, plan comparisons, advocacy, and fraud and abuse prevention. You can always get Medicare advice from the private insurance companies selling various Medicare plans, but of course, they just want to make a profit. So that is why the SHIP counselors are there, because we are volunteers and are happy to help without trying to make a profit off of you. So let's talk about what is Medicare and who is eligible for Medicare. Medicare is federal health insurance for people 65 years of age and older, and it is also for people under 65 who are disabled. To qualify based on disability, you have to be on Social Security disability income for 24 months, or if you have end-stage renal disease or ALS, you can qualify for Medicare as soon as you start receiving Social Security disability income. In order to receive Medicare, you have to either be a U.S. citizen or be a lawfully admitted non-citizen who has lived in the U.S. for at least 5 years. And Medicare is administered by the Centers for Medicare and Medicaid Services, and enrollment is through the Social Security Administration or the Railroad Retirement Board. So this is important to note. This confuses people a lot. You sign up for Medicare, not through Medicare agency itself, but through Social Security. Medicaid is an individual health plan. Choices are individuals, not spouses or families. You have to be 65 to receive Medicare. It doesn't matter if your spouse is 65. If you're under 65, you cannot receive Medicare unless you're disabled. And what is best for one person may not be best for the spouse. So spouses can choose and probably should choose different Medicare plans depending on their individual health needs. The Medicare alphabet, I'm sure you've heard these letters thrown around, A, B, C, D, and then the supplements also have letters G, K, lots of letters out there. So let's try to understand the Medicare alphabet. So Medicare Part A, think hospitalization. That covers inpatient hospital services, some skilled nursing, some home health and hospice. Medicare Part B covers prevention, doctor visits, some therapies, ambulance, and durable medical equipment. Medicare C is the Medicare Advantage plans, and we'll go into a lot of detail about those coming up. Medicare D is prescription drug coverage, and Medicare supplements, also known as Medigaps, are policies that help pay Medicare copays and out-of-pocket costs. The important thing to remember about Medicare is that everyone on Medicare has one basic choice, and that is either to receive what's called original Medicare or to join a Medicare Advantage plan. If you have original Medicare, you'll receive A and B services. You'll need to purchase a prescription drug plan separately, and then in most cases, you'll want a Medigap, a Medicare supplement plan. Alternatively, if you decide to go the Medicare Advantage route, you will join a Medicare Advantage plan, and then that plan will cover all the services that Medicare A and B cover, and will also provide prescription drug coverage. So the Advantage plan is kind of the one-stop shop. You have one plan, or with the original Medicare, you have several parts. But just keep that in mind as we go along. Otherwise, it's kind of confusing. Well, Medicare in general is confusing, but that part is confusing if you don't kind of get that basic concept that everyone either has original Medicare or an Advantage plan. Okay, so Medicare enrollment periods. This is very important because you can only enroll in Medicare at certain times, and there can be bad consequences if you miss the deadlines. So the first time you can enroll in Medicare starts right before your 65th birthday. So you can enroll 3 months before the month you turn 65, the month you turn 65, and 3 months after. So let's take an example of someone whose birthday is April 10th. If your birthday is April 10th, you can sign up as early as January. And if you sign up during January, February, or March, your coverage will start April 1st of your birth month. So the coverage is always going to start April 1st of any month. If you sign up during your birthday month, so if you sign up in April, or if you sign up in May, June, or July, then coverage will start the first day of the next month. There is a special rule if your birthday happens to be on the first day of the month. So if your birthday is April 1st, if you're an April Fool's baby, then your coverage can start as early as March 1st. So everything kind of moves back a month. If your birthday is April 1st, you could sign up starting December, January, or February, and your coverage will start March 1st. And also for those people receiving Social Security, so if you're receiving a monthly Social Security check at least 4 months before you turn 65, then you will automatically be enrolled in Medicare Parts A and B. So if that's not the case, if you're not receiving Social Security when you turn 65, you need to proactively enroll again and you enroll through the Social Security Administration. Okay, there's also the open enrollment period, and this is from October 15th through December 7th each year, and that is when you can make changes to various aspects of your Medicare coverage. So if you signed up for Medicare Advantage plan, you can change to another Advantage plan, or you can go back to original Medicare. You can go from original Medicare to an Advantage plan. You can change your prescription drug plan. And any change you make during open enrollment will start on January 1st. And that's why during this time period, you see all those advertisements for Medicare on TV and various other places. There's also the general enrollment period. which is for people who missed their initial enrollment period. So say that our example of the person whose birthday is April 10th, forgets to sign up for Medicare, and then in September decides, oh geez, I need to sign up for Medicare. Well, they have missed their 7-month initial enrollment period, and they would have to wait until January 1st to sign up for Medicare, and in which case it would start February 1st. So yeah, you would lose a lot of months of coverage, so it's very important to sign up during your initial enrollment period. There are also special enrollment periods in certain circumstances which let you sign up without waiting for the general enrollment period, and which allow you to make changes without waiting for the open enrollment period. One is if you move out of the geographic area that your plan covers. Another common one is if you left coverage from your employer. We'll talk about in a minute that if you are working and have employer insurance when you turn 65, you can delay enrolling in Medicare. And then once you lose that coverage, you will have a special enrollment period to enroll in Medicare without waiting for the general enrollment period. People who have Medicaid to help pay their Medicare costs have special enrollment periods to change plans. And Medicare Advantage plans and drug plans are giving a star rating from 1 to 5. There's not that many 5-star plans, but to encourage that, if you're in a plan that's not a 5-star plan and want to move to a 5-star plan, you can do that at any time with a special enrollment period. Okay, so as I mentioned before, people who are working at age 65 can delay their enrollment in Medicare. So you don't need to enroll in Medicare when you turn 65 as long as you have employer insurance. And it can be because you're working or your spouse or partner is working, but it does not count. COBRA does not count. And the company you work for has to have 20 or more employees. As long as that is the case, you don't need to sign up for Medicare Parts A and B, and there will be no penalty when you later sign up. Now, Medicare Part A is usually free, and we'll talk about that in a minute. But since it is free, most people will enroll. We'll just give them extra coverage in addition to the employer coverage. However, if you have a health savings account and want to continue contributing to that account, then don't sign up for Part A because you will not be able to contribute once you're on Medicare. Part B has a monthly cost, so that's why people will delay the Part B so that they don't have to pay the monthly premium. And if you have delayed your Part A and B, then once you lose that employer coverage, you have 8 months to enroll in Medicare to avoid a late enrollment penalty. Okay, so the costs for Medicare. Yeah, Medicare is not free. Many people think it's free, but it is definitely not free. There are lots of costs involved with Medicare. So for the Part A, which is the hospitalization, for most people, there's no monthly premium. So for most people, Part A is free. So it's free if you've worked and paid into Social Security for 4 quarters, or basically 10 years. Or if your spouse has worked the 4 quarters, then your Part A is free. If you've worked less than that, Part A would either be $285 a month or $518 a month, depending on how many quarters you have paid those taxes. And then Part B, which is the medical insurance, also has a cost. The monthly premium for Part B is $185. And this applies to everyone, no matter whether you've worked those 4 quarters or not. Everybody has to pay the monthly premium. That does increase each year for inflation. It's currently $185. There's that penalty if you don't enroll when you're first supposed to and don't have a reason, like you're covered by employer insurance, then you pay a penalty of 10% of that premium amount for each 12-month period that you were not enrolled, and that penalty is applied every month for the rest of your life. So you really want to avoid that penalty if you can. Also, for high income people, there's an additional cost for that Part B, depending on your income. It's called IRMA, which is Income Related Monthly Adjustment Amount. For single people, if your income is $106,000 a year or more, you would pay that. And for married filing jointly, if your income is $212,000 a year or more, you would have to pay that additional amount. And again, for Part A and Part B, for information about whether you're entitled to it And to enroll, you would contact Social Security, and the information on contacting Social Security is there. So for people on original Medicare, again, meaning they don't have an Advantage plan, with original Medicare, you can go to any healthcare provider that accepts Medicare, and then you would pay, you have deductibles and copays. So for Part A, which is hospitalization, you're going to have a deductible of $1,676 this year for hospital stays up to 60 days. And then there's a co-insurance beyond that for days up to 150. Medicare Part A will cover skilled nursing as long as you have first been admitted to the hospital for at least 72 hours and then go to that skilled nursing facility within 30 days of your hospital stay. The Part B deductible, and again, Part B is doctor's visits, medical tests, that sort of thing. There's an annual deductible, which is $257 this year. So you pay the first $257, and then after that, Medicare covers 80%, and you have to pay, you're responsible for 20% of any service. And there is no yearly out-of-pocket maximum for original Medicare. There is no cap on the yearly amount you would have to spend, as there is with a lot of employer insurance. And Advantage plans do have a yearly maximum, but original Medicare does not. For your prescription drug coverage, if you have original Medicare, that's going to be provided through a Part D standalone prescription drug plan that you purchase through a private insurance company that contracts with Medicare. Or if you have signed up for a Medicare Advantage plan, they will provide the prescription drug service. And the different plans will cover different prescriptions at different copays. The costs can vary widely. So you can compare plans at medicare.gov, or you can call Benefits in Action, and we will help you choose a prescription drug plan. And we can help both when you're new to Medicare, and then every year during open enrollment, you can switch your prescription drug plan or your Advantage plan. And so we're happy to help you find the best plan for you based on the prescriptions that you are currently taking. So the cost for prescription drugs, those standalone plans cost anywhere from $0 monthly premium up to $143 a month this year. And this year, what you would pay, so you may or may not have a monthly premium. You may or may not have an annual deductible. If a plan does charge a deductible, it can't be more than $590. And then you have co-pays each time you fill a prescription. A new wonderful thing for 2025 is that the donut hole is gone. You may have heard about the Medicare prescription drug donut hole, where people who had high prescription costs, Medicare would cover it, and then Medicare would stop covering, and the people would have very large out-of-pocket costs. But as of 2025, the maximum you can spend for covered drugs in any 1 year is $2,000. So once you spent $2,000 on prescription drugs, which is a very high amount, but at least there's a cap now, then you have no co-pays for the rest of the year. And this is for prescription drugs covered by Medicare. And this chart compares the way it used to be with the donut hole with what we have now. But the important thing is just to remember the $2,000 cap. Okay, and before we start talking about Advantage plans, I'm just going to give a little Medicare history. Medicare started on July 30, 1965. President Johnson signed the bill into law. And President Truman had wanted to get something like Medicare started, but wasn't able to get it passed. But to honor Truman, he was there at the signing ceremony. And Johnson gave Truman the first Medicare card. So he was the first enrollee. And then he gave his wife, Bess Truman, the second Medicare card. So Harry Truman and his wife were the first and second enrollees in Medicare back in 1965. And when Medicare first started in 1965, that Part B monthly premium was $3. It's now $185. And Medicare Part C Advantage plans came around in 1997. So there were no Advantage plans before 1997. And then the prescription drug plans, the prescription drug feature was added in 2003. And according to the latest numbers from the federal government, there's 68.5 million people enrolled in Medicare currently. And 50.9%, so just slightly over half, have Advantage plans, and 49.1% have Original Medicare. Okay, so for the Advantage plans, Medicare Part C are called Advantage plans. And these are plans you sign up for, offered by private insurance companies like Kaiser, Cigna, United Healthcare. All sorts of companies offer them. Those companies contract with the federal government, and they provide all of these services that you would get under Medicare Part A and B, and they also include prescription drug coverage. Original Medicare does not cover dental, vision, and hearing. Medicare Advantage plans can cover those, and most do provide some coverage. It's usually fairly minimal coverage, but at least you have some dental, vision, and hearing, and they can also offer some other perks. And Advantage plans are either HMO or PPO plans. With HMO plans, you need to stay in network. And with PPO plans, you can go out of network, but then you would be charged more. So for people new to Medicare, one important thing in looking for a plan is to see which Medicare Advantage plans your doctors are in network with, if you want to keep your existing doctors. If you have in order to have an Advantage plan, you first have to be enrolled in Medicare Parts A and B, and you must continue to pay that Part B premium. So everyone in an Advantage plan still pays the Part B premium, currently $185 a month. And Advantage plans can charge an additional monthly premium. A lot of them don't charge any monthly premium, but that premium can be as high as $197 a month. So that's $197 in addition to the $185. Advantage plans do have an out-of-pocket maximum for services other than prescription drugs. And for 2025, that maximum can be no more than $9,350 if you stay in network. So many plans have a lower maximum, but they can't have a maximum more than that. The plans available to you are based on your zip code. And you can search for plans at medicare.gov or call Benefits in Action, and we will help you pick a plan. In many zip codes in the Denver area, there can be up to 57 Advantage plans to choose from. So it can really be overwhelming. So that's why we are happy to help you choose a plan. Okay, so the Medigaps are the supplemental insurance for those people on Original Medicare. The Medigap will pay the costs that you would otherwise be responsible for. Again, for Part B, Medicare pays 80%. You would be responsible for 20%. So the Medigap policy will pay that 20%. Medigap plans, there's 8 standardized plans available in Colorado, and they are known by letters. I think Plan G is usually the most common one. And the average cost is $120 to $200 per month. Again, that's in addition to the Part B premium of $185 a month currently. You can enroll at any time of year, but you really should enroll when you're first eligible for Medicare, because you have a guaranteed issue right, and I'll discuss that in the next couple of slides. The Medigaps are regulated by federal law, so every G policy is going to provide the same benefits. Every M policy is going to provide the same benefits. And how the Medigaps work is that you go to the doctor bills Medicare, Medicare pays 80%, and then your Medigap will step in and pay the remaining 20%. The Medigaps do not include prescription drug coverage, so they don't pay any of the prescription costs. You would still need a prescription drug plan. And again, you can't have a Medigap if you have an Advantage plan. They only work with Original Medicare. So let's kind of talk about the pros and cons of having Original Medicare with a Medigap or having an Advantage plan. The good thing about Original Medicare with the Medigap is that it's portable. You can go to any doctor facility that takes Medicare anywhere in the country. You don't need referrals to a specialist. and the Medigap will cover all or most of the 20% that Medicare does not cover. Medigaps will also cover that Part A deductible. That's the deductible for hospital stays. And some of the Medigap policies will cover healthcare in a foreign country if you have an emergency. The negatives of Medigaps is that they are expensive. You have that additional monthly cost on top of the Part B cost. And they also don't include drugs, so then you have to buy a separate Part D drug plan. There are very restrictive rules about when you can sign up. If you sign up for a Medigap during the first 6 months you're on Medicare, then they are not allowed to do medical underwriting, meaning they have to take you without regard to your medical conditions. If you sign up after the first 6 months and you don't come under one of the exceptions, there are a few exceptions, but if you sign up after the first 6 months, then the companies will do medical underwriting. And so if you have an expensive health condition, they either will not offer you a policy or they will charge you much more than the standard premium. So it's really important to note that it's kind of a once in a lifetime decision. When you're new to Medicare, if you want a Medigap, get it then. Otherwise, you may not ever be able to get one, or it might be extremely expensive later on. So yeah, everyone has to choose their path, whether they want original Medicare or an Advantage plan. In all cases, you need to sign up for Part A and Part B, and you need to pay that Part B premium. If you have original Medicare, then you'd follow the path on the left side of the slide. You would also need to get that Part D prescription drug plan. Although remember, there are some that charge no monthly premium. And then you would probably want to get the Medigap plan to cover the copays, remembering that there is no monthly maximum, no yearly maximum out-of-pocket limit with original Medicare. The other path is to choose a Medicare Advantage plan, which will provide all the services that you would otherwise get through Part A and Part B, and they will include prescription drug coverage. Most Advantage plans include prescription drug coverage. There are some that don't. If some people have drug coverage through other sources, and then they can get an Advantage plan that does not provide the drug coverage. So other factors to look at in choosing your Medicare path. So with original Medicare and the Medigap, the premiums for the Medigap can change at any time that the plan can justify an increase with the Department of Insurance. So it's not just once a year, they can increase their rates during the year. Whereas if you have a Medicare Advantage plan, the premiums are locked in for a year beginning on January 1st. With original Medicare, you can go to any doctor in the country who accepts Medicare. You don't need referrals. Whereas with an Advantage plan, you must see an in-network provider in your geographic area. With Medicare Advantage plans, the only time you're going to be covered when you're outside of your home area is if it's an emergency. The Medigap plan's benefits don't change from year to year. They're locked in, whereas Advantage plans each year can change what they offer. Let's look at the costs. Well, with original Medicare plus the Medigap premiums start at approximately $120 a month, and they're going to increase regularly. Whereas Advantage plans, many have no monthly premium or a low monthly premium. That Medigap is going to pay basically whatever Medicare doesn't pay. And with the Advantage plan, there are co-pays. For example, a doctor's visit might be $25. A primary care might be free or $25. A specialist might be $50. They might charge you to, $250 for an MRI. They're going to have their list of what you pay for various services. The original Medicare plus the Medigap, the coverage is standardized by Congress. So each plan is going to cover the same benefits, no matter what the company is. With Advantage plans, they're each different, and the Advantage plans can offer those extra benefits such as dental, vision, hearing, whereas the Medigap plans and original Medicare do not provide those services. So as we've discussed, the Medicare is costly, and the prescription drug part of Medicare can be costly. So there is a program called the Extra Help Program, which helps people pay their prescription drug costs under Medicare. The application is through Social Security, and I have the link there, and it's very easy. It takes about 10 or 15 minutes to do online, and they'll let you know whether you qualify within 2 to 3 weeks. And it is only available for low-income people with minimal assets, which I'll get to the amounts on the next slide. If you do qualify for Extra Help, it will pay for all or part of your drug premium and your deductibles, and it will lower the drug copay that you are required to pay. And if you do qualify for Extra Help, then you're given monthly special enrollment period to change your prescription drug coverage. And the Extra Help Program is also known as LIS, so Low Income Subsidy. So Extra Help, LIS, it's the same program, just 2 different names. To be eligible for the Extra Help, for single people, you need to have gross income less than $1,956 a month. For married people, less than $2,644 a month. And then there is a asset or resource limit. That limit, however, does not include a residence and a car, and certain other assets are excluded. And we can help you apply for that Extra Help Program at Benefits in Action. If you give us a call, we can apply for you for that program. For people with even lower income than those amounts, there's also Medicare savings programs. And this is a form of Medicaid which helps cover Medicare costs. There are income limits. You can see it's really quite low. You need to have income of less than $1,781 a month for single, or $2,400 a month for married. Again, there's that resource limit, not counting certain assets. And if an individual qualifies for Medicare Savings Program, then that will pay that Part B premium of $185 a month. And it, depending on your income, can also cover co-pays, co-insurance, and deductibles. And at Benefits in Action, we can apply for a Medicare Savings Program for you. Okay, I understand that at least some or maybe all of you are eligible for Paracare when you retire. So I will just briefly talk about that. Paracare is Para's health benefits program available to retirees of Colorado government agencies and their eligible dependents. And Paracare offers 3 Medicare Advantage plans that are only available for Paracare beneficiaries. To enroll in a Paracare Advantage plan, you must first enroll in Part A. But if you are not eligible to enroll in you must first enroll in Part B. And if you are required to enroll in Part A, if you can enroll at no cost, but if you are one of those individuals that would have to pay for Part A, then you don't need to pay for it, and you would still have all that hospitalization benefits included in your Paracare. And I've provided a link to the Paracare website, which is very helpful and provides a lot of information about how Paracare works with Medicare. I will briefly talk about Medicare fraud. The Senior Medicare Patrol are individuals who try to detect Medicare fraud, inform people about fraud, and encourage people to report fraud. And these following slides are provided by the U.S. Department of Health and Human Services. So there are 4 R's for fighting Medicare fraud, which is to record, review, report, and remember. So record all your medical services that you get through Medicare, and then review your statements. You will get a statement either directly through Medicare, if you're on original Medicare, or through your Part D, your Advantage plan. And what you want to do is look at the statement and make sure that all the services that are billed on that statement are services that you actually receive, and that there's not any duplicates. It could be a mistake, but most likely, if there are errors, that is fraud, because there's just a lot of Medicare fraud out there, and it ends up costing taxpayers money. So we want to stop the fraud. So if you do suspect fraud, please call one of these phone numbers. And then remember never to give out your Medicare number, never give it out in exchange for special offer, never let anyone use your card, and never use another person's Medicare card. Some of the scams we're currently seeing are offers for free genetic screening if you provide your Medicare information, billing and sending braces that aren't needed, providing hospice benefits for long periods over and they're not needed, billing for power wheelchairs and scooters when not needed, and double, triple, and quadruple billing for services. If you have any questions, please contact Benefits in Action. If you suspect fraud, call the Senior Medicare Patrol. I have the information for Medicare. You can contact them directly, and that number is available 24 hours a day, 7 days a week. And the contact information for Social Security. And remember, you contact Social Security to sign up for Medicare. Benefits in Action is always looking for volunteers. So if you or anyone you know is interested in volunteering, we always need Medicare counselors. We also need people to assist with applications for SNAP, Medicaid, and other benefits. We do free income tax return preparation in the tax filing season. Food delivery, we deliver food boxes to people. We always can use help with our fundraising. So if any interest in that, please contact Benefits in Action. Okay, and now I will check on questions. So just one moment here.
Thank you, Karen. I don't see any questions in the chat. I mean, I did put in a question for the folks who are attending.
Okay.
And now I'm going to open up and make sure that anyone who is on this call has the opportunity, because that's a lot of information, just literally Medicare 101. I know about Medicare and always I'm learning like, oh, so that's what they mean when I hear them say this, when I attend something like this. And I think it's really helpful. So thank you so much. So my question in the chat for the folks who are here, well, it's one is for us as library professionals, right? And so I guess my question is there any questions that you get asked by library visitors that maybe need help with Medicare? And whether Karen has answered it or not, maybe this is a really good chance to like, this is a question I get, or even if it's just like, because I remember, I mean, it was like yesterday, essentially, where I was in a library and I would get questions too. And some of them are very simple, like, I need to get to the website and I don't know what the website is for me to like check on my benefits election, right? And that, of course, then includes that. Or I heard something on the news, like people would just talk to me and say something like, I heard something on the news, and what do you mean all of a sudden we don't get Medicare? And I'm like, what are you guys talking about? And it's that they heard something about a Medicare expansion in our state versus another state, right? So is there anything from you guys who are attending, anything that you get asked often enough, or maybe that stands out enough, maybe a fact that you've heard that Karen can help give us some information about or enlighten us about, that comes from the outside, right? So like a community member. Oh, yeah. So Mary put in the chat. So I will read it out loud so it's captured on video. Medicare penalized my husband like at a cost because he was covered under my group insurance. And she works at a very large company, right? So is that, I guess, Karen, something that people should worry about? Like, do you have medical coverage elsewhere when you're electing for or have been elected for Medicare?
Yeah, you might want to call Benefits in Action and we can look into that, because I mean, if he was covered under your policy with more than 20 employees, yeah, he shouldn't have that. I assume that's a late enrollment penalty, unless he took him more than 8 months after he was no longer covered to sign up. But yeah, it seems odd. I mean, because if you are covered by the group insurance, you shouldn't have an issue. So yeah, I would suggest to call Benefits in Action, make an appointment, and one of us can look into that.
Is it possible for you to put back the slide with the contact information so that we
Sure.
can see it? So that's something that we had Rachel Wise come in a couple weeks ago, and we'll have Eric come in a couple weeks from now. Eric is going to do Social Security, disability, and assistance. And Rachel did kind of a general thing. And one of the takeaways, I think, from Rachel's presentation was that Benefits in Action, we can contact them as individuals when we have questions, certainly, but also at our libraries, we can kind of navigate folks to them as a resource, whether it's to make an appointment or to just ask some questions. And Karen, my understanding is that you have folks who are available to help in more than one language, correct?
Yeah, and we also have a translation service we use, so yeah, we can
Oh,
have.
excellent.
Mhm.
Um, so what about Plan F, Mary asks.
Oh, Plan F, the Medigap. Yeah, Plan F is one that is not, it's grandfathered. So if you have it, you can keep it, but people new to Medicare, basically G is pretty much the same as F. F used to cover that annual deductible, Part B deductible, and now they no longer allow that. So, however, yep, yeah, does that answer your question?
I hope so. One of the questions I get as a librarian for librarians is really less a specific question and more a concern. There's a lot of changes happening at the federal level, and something like Medicare, right, comes out of, or at least starts at that kind of high level federal government. So if it is the case that changes are happening and folks either, like they get a letter or an email that says suddenly something about their plan or their coverage is different than they thought it was or than it has historically been, would Benefits in Action be someone that we could have folks call so that we can help them kind of navigate through that
Oh, yeah, absolutely.
change?
Yes, yeah. Yeah,
Good.
nobody, obviously there's changes to Medicare all the time and, we don't know what changes are coming, but yeah, that's what we're here for, to help people navigate those changes.
That's excellent. That's something that we could use as a de-escalation tactic too at libraries, because as you know, like
Right,
when your
yeah,
healthcare is like the number of, like, it literally is a live or die kind of thing, people
right,
can
yeah.
get very afraid, I would say sometimes aggressive, sometimes really emotional. And so being able to say, we have a place that can let's work together to get you this resource, someone can talk to you. I think that might be really helpful.
Mhm.
Bonnie put in a question. With Advantage plans, what is, quote, capitated payment from Medicare?
Okay, so that's the Advantage plans contract with the federal government. And for every person on their plan, they get a dollar amount from the government. So the per person, and then they get more money if people have health conditions. But that's the payments that they get from Medicare to have people on their plans. That doesn't, that doesn't affect an individual on the plan. You're not going to know how much the government's paying, but that's just how it works.
Now, Medicaid and Medicare, I'm going to ask a question that you answered, but I just kind of want to put it out there. Medicaid and Medicare are not the same thing.
Oh,
However,
mhm.
folks who are on Medicare may be folks who also get Medicaid,
Yeah,
correct?
thank you. Yeah, thank you for bringing that up. Yeah, so and people who are on Medicaid, once they turn 65, they lose that Medicaid. So general Medicaid is for under 65. And they need to, a lot of people, if they're not receiving Social Security, they need to apply. A lot of them don't realize this. But so yeah, once you turn 65, you go from Medicaid to Medicare. And then if you are low income, although it's different income limits and different requirements, but then you can apply for that Medicare Savings Program, which is a part of Medicaid, and that will help pay the Medicare costs. So yeah, we get that. It's really very confusing for people, but yeah, once you're 65, Medicare needs to be your basic insurance, and then you can apply for Medicaid if you're low income and low assets to help pay those Medicare costs.
Correct. And if there are questions that folks have, for example, they may have a child who has cerebral palsy, that child is qualified for Medicaid, but they didn't understand that and they didn't know that. Would Benefits in Action also be a place that we could route them to for questions?
Yeah, I mean, I'm just a Medicare counselor, but we have people that do Medicaid counseling. They help you apply for Medicaid benefits, help with your annual recertification, all that, yeah.
And if
Absolutely,
it's a 65 plus, kind of defer to, let's just call Medicare questions, right? And then from there, we can kind of, you rather can unpack the need, correct?
right, right, yeah, we'll figure out, yeah, what, we'll figure out where to send you, but right, yeah, call Benefits in Action and we'll get you to the right counselor who can help you navigate your issues.
Thank you very much. So my, if there, is there any other, oh, there we go, Christine. Are green card holders who are 65 but not yet eligible for Medicare due to immigration status penalized for not signing up for Medicare at 65?
That's a good question. I don't know the answer. I assume not. I mean, because if you're not even eligible, I don't see how they would penalize you for not signing up, but I don't know. I mean, if you call Benefits in Action, we can research that and get back to you, but I don't know off the top of my head.
Yeah, I would also say that for that question, Christine, there are probably really good immigration and like Office of New Americans kind of more broadly, because not everyone would be quote an immigrant, right? Some folks are seeking asylum, some people are under work visas and then got a green card. So I would say also, if not, if questions can't be answered because they're so specific to immigration status or residency status, it might be good to call someone like the Colorado Immigration Resource Council. Um, and that's CIRC, kind of like it's Library Life, but it's like CIRC, CIRC. You can find them online. And I say that if you're in Colorado. If you're not in Colorado, Immigrant Rights Council, just kind of generally, or the Immigrant Legal Resource Center tends to be really good. And the only reason I point that out is because there are very many 65 plus varying residency status folks. And I am promising you that someone has gotten a letter saying, you owe us money, even though they're like, what are you talking about? So it's important to know that those things do happen. I want to thank Karen and thank all of you for showing up. Many people registered for this webinar. Many people registered for the last one from Benefits in Action. Many people have registered for the future one. There is an additional webinar. I will be meeting with someone tomorrow about SHIP, which Karen mentioned, and it is so crucial. And I just want you to know, you don't have to do any of this. And it might just be good to know. So when someone walks in the building, you don't think like, oh my God, what is this craziness somebody's talking about that I've never heard of? The more we know, the better it is for us, the easier it is for us to find a resource to help, even if it's not us, right? Sometimes we're just a point along the way. So I would like to thank everyone for showing up to be a waypoint for so many other people, especially now. We have so many questions and so much uncertainty. Thank you so much. I will,
Thank you
oh,
for your time and attention. I appreciate.
of course. I'm going to follow up with my promise at the end of this. Probably not today because I'm on the road, but I will upload the video to YouTube. Everyone who registered will get a webinar recording link. Anything that Karen sends me. So Karen, if you send me the slides, I will share them along. In
Yeah,
addition, I will share the link for the upcoming Benefits in Action webinar with Eric, which is on Social Security and Social Security disability insurance. Those are questions that I know I personally have, but we get them all the time in libraries too. I've helped so many people sue the government claiming that they deserve stuff. You know how it is, library life. And if I get some information and I'm able to schedule other webinars related to similar things, especially concerning our older adults, I'll make sure to also send you the links for those on the calendar. I'm going to stop the recording now and make sure that I don't get like kicked out of a room. So let me go ahead and do that.